As we get closer to our golden years, it will only be a matter of time before many of us will hear the words knee replacement surgery. But there's a new solution available that could keep us on our feet without the need for surgery. Here to explain, please welcome the director of the Spine and Osteoarthritis Center of Texas, Dr. James Ninh, along with his patient, Susie Taylor. Hi. Especially with an aging population, unfortunately, a lot of us will need the knee replacement, but fortunately, there are things that we can do before that point that could be effective as well.
Exactly. You know, at some point, everybody's going to experience some type of arthritis, and we hear a lot of terms called bone on bone. You know, in some cases, knee replacement surgery is going to be necessary. But before we even go there, and for the vast majority of patients, there are a lot of alternatives.
Yeah.
And what we do is we also offer vesicle supplementation injections.
Okay, we're going to explain exactly what that is in a second. But first, Susie, you started noticing some issues with your joints about when?
A couple of years ago.
And what was that like?
Well, you would lose your balance. I did. I fell a couple of times in the last year or so, and I didn't have the strength that I did have, and I went to a doctor, and he said I had needed a knee replacement.
Yeah, and of course, when a lot of us hear that, we think, is there something I can do in between then? So there were some things that you did, and some things, doctor, that people can do to try and lessen the pain, and so what are some of those interim things before you kind of have to move on?
Well, obviously, you want to strengthen the knees. There's a lot of things we can do when we're younger, avoid a lot of high-impact exercises like running, running on concrete. There's a lot of things we can do to prevent that from getting worse.
But what she ended up doing before going to get a knee replacement, which, you know, is pretty involved, it has other things going on there, but what she ended up doing was what you talked about, that supplementation. What is that exactly?
Well, this is a vesicle supplementation. It's a different type of injection than cortisone, which is readily injected. It is a substance that is extracted actually from rooster comb, and it's almost identical to the natural substance that's in your knees. It's called synovial fluid, and when we do these injections, we do it under live x-ray or ultrasound. So it's guided, so we go exactly where the needle needs to go, into the capsule. And we can see here where once we go inside that capsule, we'll inject a little bit of contrast to confirm where we're at.
Yeah.
Because if the vesicle supplement is not where it needs to go, it's not going to do anything.
Yeah, and this is actually a picture of her knee, of Susie's knee. And so what it basically is doing is providing that padding so you're not bone on bone anymore?
Exactly. The fluid will bond to the cartilage, bond to the bone, and act as a shock absorber. So it prevents the bone from actually rubbing against each other. It's kind of like changing the oil in your car.
Yeah, and it makes total sense. But like, Susie, when you first heard about this, did you think it was going to work the way it's worked for you?
I wasn't quite sure about that, but I asked a couple other people who had had this done, and they said they were doing real well after a year.
Yeah. So what was it like to suddenly go from the falling and the pain and the bone on bone to finally being able to get your old self back again?
Wonderful. I have had no pain at all.
Your husband, Bob Taylor, is with us this morning as well. And Bob, you know, kind of tough to see your partner, who's somebody who's active in life, kind of be, you know, going through that to begin with. So this is going to be a godsend for you all.
That's true.
And what types of things are you guys doing now that you couldn't do before?
We're starting to walk some more. We used to walk a lot in the neighborhood. Now we're walking and like to dance.
Ah, okay. If we had known that, we'd have brought the disco ball. Okay. So, Dr. Ninh, she said that she has some friends who had done this, and it had, you know, been great for them up to a year. About how long could this be expected to last?
It varies with different patients. Studies have shown 6 months. We've had patients go many years with improvement, with less pain and a lot of stiffness. But our knee program is more geared towards not only reducing the stiffness and the soreness, but pretty much getting the patients their lives back. I mean, we have a lot of patients who are unable to play with their grandchildren. They have difficulty standing or rising out of bed or from a seated position, or just simply walking. You know, walking around the mall is just very challenging with arthritis. So we can even reduce some of the stiffness or reduce some of the symptoms and allow you to live an active lifestyle. it'll change their daily activities.
Yeah, because it really does. It starts that spiral downward for a lot of folks when you can't be mobile. When you can't, like some people, like my mom, loves cleaning her own house. When you can do those things, going walking, like you're saying, being independent. And then when that you have that sedentary lifestyle because you're in pain, then things just kind of go haywire after that. But if you can keep people active and mobile, this is a great way to do it. So we're talking about it in the knees. Can we use it in other joints or even in the spine where we have that bone-on-bone situation
Well,
for a lot
right
of
now
people?
it's only FDA approved for the knees, but what we have found was a lot of patients who have low back pain, it seems to be correlated with the knees. And when you have low back pain, patients favor one side over the other, and which can progress or aggravate the knees even more.
Yeah.
And so when we look at the knees, we don't just look at the knees, we look at everything as a whole, because it could be the back that's causing the knee pain, or vice versa.
Right, because you're when you like shift, if you have one knee that's hurting, you kind of shift
Exactly.
your weight, that causes other problems.
Exactly.
Well, this is really exciting for a lot of people because, again, arthritis is one of those things that affects a wide number of people. And if there is a gap between just pain medications and actually getting a replacement, this seems like a great one to have. And so for some people, can they just be on this and that's it for the duration of their life? Is it possible that could work forever?
It really depends on the severity of the arthritis. You know, if we catch it early enough, if you're in the first early stages or even in the middle of the stages, if we can do these injections, it can actually prolong or prevent surgery down the road. Unfortunately, some patients do have the severe bone-on-bone,
Right.
true bone-on-bone, and where you'll have to have surgery. But for the most
longer
part,
you wait sometimes too before getting something like this, the longer you wait, the more damage you're causing. So
Exactly.
go ahead and get it done.
Exactly.
All right. To make an appointment for a consultation, you can call 888-730-3313, 888-730-3313. You also have a special offer for the first 30 patients.
But we do have quite a few patients coming in, and unfortunately, we do have a waiting list sometimes. So we have opened up some spots where our doctors are accepting the first 30 patients for a consultation.
Find them online at SOATX, SOATX.com. Thank you.